Understand that there is a plateau to the feel-good effects of testosterone. Once you get those levels and you have a consistent level of free testosterone, men need to stop. They could be their own worst enemy. You know, my goal, and I tell my patients, this is my job. I'm going to optimize your hormone, get them as optimal as you can get them. We're going to be to the point where you're going to have to agree with me that they can't really be any better. Or we could raise a number, but they really can't be any more optimal. And then you just need to check that box. You need to check the hormone box. And now you need to spend all your rest of your time, not on forums or not looking to tweak this protocol or that protocol, but instead you check the hormone box and then you focus on nutrition, you focus on exercise, you focus on your family, you focus on, you know, your wife, your kids, your friends, your hobbies. I'm supposed to do my job to free you up so that you can go live your life without worrying about this every day or ruminating on hormones. And men cannot use hormones like they use a stereo equalizer. You're going to have good days, good weeks, bad weeks. It's just part of life. Life is not fun all the time. Life is not easy all the time. And you can't address those hard times or stressful situations by thinking you're going to tweak your hormones to get you through it. Every year I'll get 2 or 3 men that'll call me up, Doc, doesn't work anymore. I feel worse than I did before I started. Now, I used to have a conversation with them first, but now I'll go ahead and get their labs. That's what they want. I've got to get my labs and see what's wrong because it's just not working anymore. Okay, so I'll get their labs. They come back. And Stephen, there's not been one instance that this has not been the case. Not one. So the labs come back. We meet. Well, Bill, I got your levels back. Well, your levels are the same. In fact, Bill, they're better. They're either the same or always better than they were when they felt their greatest. I said, Bill, that your levels are identical, or in fact, they're better than they were last time we talked, and you felt great and everything was wonderful. Understand, hormones don't stop working, Stephen. People do, but hormones don't.